I'm Lisa Lynn Evelyn from Lisa Lynn Fit, and I'm here today just to talk to you a little bit about my diagnosis of lupus. I've been diagnosed for over 20 years, and I've had quite the tough ride with it. And there's so many of my friends and of course close acquaintances that know that I've been ill and know that I've been down at some point in time, but they're not really sure what lupus is. So when I ask people, what is lupus, they can never really answer me. So I guess I really want to educate people on what is lupus. For one, the diagnosis of lupus is it is an autoimmune disease. It is an overactive immune system which creates antibodies against yourself. So basically, my body is allergic to itself. And with that being said, so many things can be attacked in your body, basically anywhere from head to toe, your skin, your organs, any connective tissue involved. So for me, I've had basically every criteria there is for lupus. And there's 11 criteria for a diagnosis of lupus. And in those criteria, the first one usually they look for is the mylar rash. And that's the butterfly rash across the face, which I had that very predominantly in the beginning stages of my diagnosis. The second one they look for is a discoid rash, which is usually raised bumps anywhere on the body. I've had them all over my body, all over my face, all over my chest, arms, legs, in the abdominal area. So I've definitely had that very, very severe cases of it at times, causing hives also during those times. Another criteria would be photosensitivity to the sun. And I can remember back, when I was first allergic to the sun, when I was in high school and I was going to spring break, and I would get a swollen lip or a swollen eye and get third-degree burns from just being out in the sun. So my body was very allergic to the sun. So sunscreen is very important. Another thing would be, criteria would be mouth ulcers, which you can normally get on the lips or inside, internally in the mouth, and also what comes with that is nose ulcers as well. That sometimes makes it hard to eat. I've definitely had that on very consistent occasions, and it's just one of those normal symptoms I kind of tend to deal with. So arthritis is a big one, another criteria. Any joints can be affected, and I'd say most of us as lupus patients would have some type of joint abnormality. So I've had, anywhere from the hands. I can remember the beginning stages, not even be able to open my hands in the middle of the morning as I awoke. It was really a tough thing to do. I can remember my knees, being swollen, just completely full of fluid and inflamed, and really tough to make it up the stairs. I can remember my big toes, having gout with it as well, and just inflammation in any joint, including the neck, the back, hips, just anything. So that's kind of a big one for most patients. Pleurisy is another criteria, and that's the lining around the lungs becomes inflamed. And I've definitely had that for seasonal changes, usually is when I get that. And it's tough when you take a deep breath, difficult breathing. You feel tightness in your chest. And the more movement you do, the harder it is as that pleur rubs against the lining. It becomes very painful, very painful. Another criteria would be kidney disease, and definitely have had that one as well. It's called nephritis. I've had class 3 and class 4 nephritis, where you usually spill protein in the urine, which is not a good thing. And they classify it in different phases. Whether you have a little bit of spillage, doesn't seem to be much of a problem. There's a plus, a 1+, 2, 2+, 3, and 3+, which becomes a little bit more serious. And I've had to do chemotherapy for kidney disease. I've had that, probably 3 different times, three to 4 times on several occasions, so quite a bit. Another criteria for lupus would be the central nervous system involvement. And I also have had that with seizures or psychosis, and they usually will treat that with high doses of steroids and chemotherapy. And I've definitely had my share of that. Lots of seizures, lots of mini strokes involved with the central nervous system. And also the simple thing of having headaches can be central nervous system involvement and the fogginess that we call that lupus fog or having a loopy day. It's all part of the disease activity. Another thing would be, criteria would be affecting the blood. And for me, I've definitely had the blood affected. My first diagnosis, before even being diagnosed with lupus, I had idiopathic thrombocytopenic purpura, which we call ITP, which is where my platelet counts were attacked. Basically, my spleen was taken at that time in regards that it was overactive. My spleen was doing too much work trying to cleanse the blood. I had problems with bleeding. I was basically bleeding internally. The doctors wouldn't even let me shave my legs in fear of that, in fear of me bleeding. And so that was quite the life-threatening situation. So definitely the platelet count was affected. My white count has been extremely affected, very low at times. Doing chemotherapy also can affect your white count. And so that's definitely been a problem in the blood for me as well. So definitely the red count, the white count. Anemia has been a common thing for me as well. And another thing would be, criteria-wise for lupus, would be a positive ANA. And that's when they do the blood work in the beginning to test for the ANA profile, we call it. And when there's a positive ANA, that's a pretty good red flag that there may be a diagnosis of lupus. And the next thing and the last thing would be any type of immune disorder, like an anti-DNA positive, which is usually the case in most lupus patients. So I have to say that I've been lucky and have been able to experience all of the 11 criteria. And so with me, I really want to educate people on what lupus is, and in layman's terms of how someone feels. I would have to say, to describe a day, like a bad day with lupus, would be to have flu-like symptoms, kind of a funky feel. I call it my funky time. Sometimes I'll have bloodshot eyes. I feel like the eyes become dry, the glands are affected. Definitely chronic fatigue, that tired feeling. I've had extreme hair loss, where sometimes before the chemotherapy even began, just chunks of hair would fall out. Definitely anything as far as lesions on the skin is very affected for me. A joint pain is definitely a part of it. I've been pretty good the last few years with my joints. I would say those would be the normal symptoms of a lupus patient, and so I would say that needing to rest is probably the most important thing. To stay away from stress if you can would be another really good one, and to try to minimize your time in the sun, because the sun can also be very detrimental. And it doesn't always have to show up right away. Sometimes it's a cumulative effect on all of that, and sometimes it just gets you. And sometimes our immune system is so overactive that we're taking immunosuppressive medicines, and so therefore you need to be really careful with infections and people around you that have a common cold or the flu, because you have a better chance of getting that, which is not a good thing. So I just wanted to sum that up, and just to give you an idea of what people are dealing with that have lupus. And we do share a lot of symptoms with other types of autoimmune disorders. So normally we would see a rheumatologist for that, and that's what I do. And I'm on different medications, and I also do natural therapy with chiropractic and acupuncture. So I think the mix for me with the Western and Eastern medicine has been very helpful. So if you want to tune in and check out any more information, I want you to go to www.livefitwithlupus.com. And thanks for listening to me, and come follow me on Facebook, Twitter, and Instagram. I'm Lisa Lynn Fit, and please live fit. It helps very much. Thanks for your time.